Hi, my name's Kristen Eagles. My student number is T00698082. Today I'm going to be going over feline blood collection. I have Megan here helping me to hold, and we have our patient here on the table. So first we're going to go over medial saphenous blood collection. So you'll have the patient in lateral restraint. So it's going to be on the medial aspect of the hind limb. So you've got the limb that's on the table. So Megan's going to be occluding kind of up proximal to the body, and then we'll have the vein kind of running along the medial part of the leg here. So we have all of our stuff here that we need. So we have our syringe with our 22 gauge needle. We have our alcohol, our tubes to put the sample in, and then just some wrap in case there's any issues. So we'll start here. So we'll do some alcohol. You want to make sure the bevel is up. And we'll insert into the vein. And then draw back to look for a flash. If we're in there, then we'll just pull back and collect our sample. And then once we have our sample, I'll get her to release, and then I'll pull out and she'll hold off. And while she's holding, we'll put our samples into our tube. So we'll do the green top first, which is our lithium heparin. We'll put that in there. And rotate. And then into our EDTA tube. There. And then we'll label that with the patient's name, species, the client or the patient number, and the date, and my initials. And then we'll check the leg to make sure that there's no bubble forming, and if there is, we can always put the wrap on just to hold for a little bit. Okay, so next we're going to do jugular draw. So we'll get the patient in sternal or in sternal circumferency. So we're going to be going into the jugular groove right in here, so it's just lateral to the trachea. So he would occlude at the thoracic inlet right down here, and in that way we'll see our vein right there. So we'll do alcohol, we'll visualize the vein, have our bevel up, insert, and then retract for some flash of blood, and then collect our sample. Once we have our full sample, I'll release and then withdraw, and then I'll get her to hold off. And then we'll put our sample right into our tubes.